If you are over the age of 65, the vitamins you are taking every morning might be completely useless. In fact, taking the wrong supplements without understanding how an aging body actually works can be dangerous. Today, I'm going to walk you through every single vitamin and mineral that seniors actually need, explained in order of biological importance. I will cover absolutely everything you need to know to protect your brain, your bones, and your joints. But I want you to pay very close attention to vitamin number 4 on this list. It is the biological traffic cop of your body. And without it, the calcium you take to protect your bones might actually be going straight into your arteries. I will reveal exactly what that is in just a few minutes. Let us start by understanding a fundamental truth about aging. A 65-year-old body is not just an older version of a 30-year-old body. It is biologically different. The biggest change happens right inside your stomach. As we cross our 60s, the production of stomach acid drops drastically. This condition is known as hypochlorhydria. Why does this matter? Because even if you eat a perfectly healthy diet filled with organic vegetables and high-quality proteins, your body simply cannot break down and extract the nutrients from that food the way it used to. The extraction machine has slowed down. This is exactly why those cheap, generic multivitamins you buy at the grocery store simply do not work for seniors. They are compressed rocks of synthetic nutrients that pass right through your digestive system without ever being absorbed into your bloodstream. To protect your independence, you need targeted, highly absorbable nutrients that address the specific deficits of an aging body. Let us go through the definitive list right now. Number 1 on our list is vitamin B12. This is the absolute foundation of your brain health and your daily energy. B12 is responsible for maintaining the myelin sheath, which is the protective coating around your nerves. Think of it like the plastic insulation around an electrical wire. When you lack B12, that insulation frays. The electrical signals in your brain start to short circuit. Many seniors who experience severe brain fog, memory loss, or tingling and numbness in their hands and feet are misdiagnosed with early-stage dementia or neuropathy, when in reality, they are suffering from a severe B12 deficiency. And here's the catch that doctors rarely explain. B12 from food requires a specific protein in your stomach called intrinsic factor to be absorbed. But as your stomach acid declines with age, your production of intrinsic factor disappears with it. You could eat pounds of high-quality beef and still be deficient. This is why seniors must bypass the stomach acid problem entirely by using a sublingual B12 supplement, preferably in the form of methylcobalamin. Sublingual means it melts under your tongue, absorbing directly into your bloodstream and instantly waking up your brain and your nervous system. Number 2 is vitamin D3. Most people know vitamin D as the bone vitamin or the sunshine vitamin, but after the age of 65, it becomes the master switch for your entire immune system. Vitamin D3 controls the expression of over 1,000 genes in your body. It is heavily responsible for regulating inflammation, maintaining muscle strength, and protecting your respiratory system from severe infections. But there is a massive biological problem for seniors. As your skin ages, it loses its ability to synthesize vitamin D from sunlight. A 70-year-old sitting in the bright summer sun produces about 75% less vitamin D than a 20-year-old sitting right next to them. You simply cannot get enough from the sun anymore, and you certainly cannot get enough from drinking fortified milk. This severe deficiency leads to profound muscle weakness, a suppressed immune system, and a deep, unexplainable fatigue that makes you want to stay in bed all day. Taking a highly absorbable vitamin D3 supplement in a soft gel form is non-negotiable after 65. It is the anchor of your daily health. Number 3 is magnesium, specifically magnesium glycinate. If you suffer from terrible leg cramps in the middle of the night, if you toss and turn and cannot stay asleep, or if you feel a constant low level of anxiety and muscle tension, you're likely magnesium deficient. Magnesium is responsible for over 300 biochemical reactions in the human body. Its primary job is relaxation. Calcium contracts the muscles, and magnesium relaxes them. Without enough magnesium, your muscles stay locked in a state of continuous tension, leading to cramps, spasms, and elevated blood pressure. But you must be incredibly careful about which type of magnesium you buy. Most generic supplements use magnesium oxide or magnesium citrate. These are very poorly absorbed and act as a laxative, pulling water into your intestines and causing severe diarrhea. That is the last thing a senior needs. You must look specifically for magnesium glycinate. The glycinate form is bound to an amino acid, making it highly bioavailable. It passes easily through the intestinal wall and crosses the blood-brain barrier, delivering deep, restorative sleep and melting away joint and muscle stiffness. We have now reached number 4, the absolute game changer, vitamin K2. Please listen to this very carefully. Millions of seniors take vitamin D3 and calcium supplements every single day to protect their bones. But without vitamin K2, you are playing a dangerous game with your cardiovascular system. Here is the biological reality. Vitamin D3 does a fantastic job of absorbing calcium from your diet into your blood. But vitamin D3 is blind. It does not know where to put that calcium. As a result, the calcium floats around in your bloodstream and starts to deposit into the soft tissues of your body. It calcifies your arteries, making them stiff and narrow. It deposits into your heart valves, and it builds up in your kidneys as stones. This is where vitamin K2 steps in. K2 is the biological traffic cop. It activates 2 specific proteins in your body. One protein grabs the calcium out of your bloodstream, preventing it from clogging your arteries. The second protein acts like a magnet, pulling that exact same calcium directly into your skeleton and locking it inside your bone matrix. Without vitamin K2, your calcium supplements are actively destroying your cardiovascular health. If you're taking vitamin D, you must take vitamin K2 with it to ensure the calcium builds your bones instead of blocking your heart. Number 5 is omega-3 fatty acids. As we age, chronic inflammation becomes the silent destroyer of our quality of life. It is the root cause of aching knees, stiff fingers, and cardiovascular disease. Omega-3 fatty acids, specifically the EPA and DHA found in high-quality fish oil, are the most potent natural anti-inflammatories on the planet. Think of omega-3 as the premium lubricating oil for your rusty hinges. When you have high levels of EPA and DHA in your cells, your body produces specialized molecules called resolvins. These molecules actively hunt down and extinguish the fires of inflammation in your joints. Seniors who take a high dose of purified omega-3 report a massive reduction in morning stiffness and joint pain. Beyond the joints, DHA is the primary structural component of your brain tissue. It keeps the cell membranes flexible, allowing neurons to communicate rapidly, which clears away brain fog and protects against cognitive decline. Do not rely on flaxseed oil. Your aging body cannot convert plant-based omegas efficiently. You need a high-quality marine-based omega-3 supplement. Number 6 brings us to a controversial topic, the calcium paradox. You have been told your entire life to drink milk and take massive calcium pills to prevent osteoporosis. But modern science has uncovered a frightening truth. Taking large doses of isolated calcium supplements causes a sudden spike in blood calcium levels. Because an aging body cannot process this massive influx fast enough, the calcium is deposited into the arterial walls. Studies have shown that seniors taking high-dose calcium supplements actually have a significantly higher risk of heart attacks and strokes. The paradox is that your bones need calcium, but supplementing it blindly is dangerous. The medical consensus is shifting. You should get your calcium entirely from whole food sources, like leafy greens, almonds, and high-quality dairy. Your body absorbs food-based calcium slowly and safely. Stop relying on giant, chalky calcium pills. and instead focus on the vitamin D3 and vitamin K2 combination to properly manage the calcium you already get from your diet. Finally, number 7 is zinc. This is your ultimate immune shield. As you enter your 70s and 80s, your thymus gland, which produces your infection-fighting T cells, begins to shrink. This makes you highly vulnerable to seasonal illnesses that a younger person would fight off easily. Zinc is the critical mineral that keeps your immune system aggressive and responsive. It prevents viruses from replicating inside your cells. But zinc does something else incredibly important for seniors. Have you noticed that food does not taste as vibrant as it used to, or that your appetite has vanished? Zinc deficiency is the leading cause of the loss of taste and smell in the elderly. Without it, food becomes bland and unappealing, leading to dangerous weight loss and frailty. A simple, low-dose zinc supplement can reawaken your taste buds, restore your appetite, and provide the necessary armor your immune system needs to protect you through the winter months. So, let us summarize this definitive list. We have sublingual vitamin B12 for your brain and nervous system, vitamin D3 for your immunity and bone absorption, magnesium glycinate for deep sleep and muscle relaxation, the crucial vitamin K2 to keep calcium out of your heart and push it into your bones, omega-3 fish oil to lubricate your joints and extinguish inflammation, food-based calcium instead of dangerous pills, and zinc to restore your appetite and shield your immune system. You do not need a cabinet full of 50 different confusing bottles. You do not need expensive generic multivitamins that your stomach cannot even break down. You just need to be smart and targeted. You need to provide your aging body with the exact raw materials it struggles to absorb from food alone. By focusing on these 7 specific nutrients, you are actively rebuilding your foundation, protecting your mind, and extending your physical independence. Now, I want to hear from you. Which of these 7 vitamins are you currently taking? And which one were you completely missing from your routine, especially the vitamin K2? Leave a comment down below right now. I read every single one of them, and I love seeing how this community helps each other.
Civilization flourished for centuries precisely because of this innovative irrigation system.
So the algorithm
truly
shares
is remarkable.
this vital information with other seniors who might be taking the wrong supplements. And make sure you hit the subscribe button to join the senior health community. We are here to bring you the absolute truth about your body. No cartoons, no gimmicks, just the science of aging well. See you in the next video.